Hi, I'm Virginia, and welcome to the Health Creators Podcast, where we talk about the impact and business of being a health information creator. And here today, I've got Dr. Emma with me. Thank you so much for being here.
Thank you for inviting me. I'm excited.
Awesome. So you recently became a dermatologist, and that's super exciting. But I will let you introduce yourself, and so the audience can get to know you a bit better.
Sure. Yeah, so my name is Dr. Emma. I'm a consultant dermatologist working in South London. I've been a doctor for about 10 years and doing dermatology for 4. I'm also the founder of the House of Medics, which is a platform created to allow all healthcare professionals to get a sense of community. And we do a lot of health education, health outreach, and mentorship for students. And I'm also a content creator. I create my own content about skincare and haircare.
Amazing. Thank you so much. So first question is, why did you start creating health education videos? What was the spark that got you going?
I just think because of the industry I'm in, there was so much misinformation, and specifically amongst the Black community, just scrolling like online, Instagram, TikTok, I just see so much wrong information and videos with millions and millions of views. And it's super, super frustrating. Obviously, as a healthcare professional, you want people to know the truth so that they can make the right decisions for their health and obviously, maximize their longevity. So the main thing was that I really just wanted to put out some credible information. And in America, there are so many dermatologists online, but in the UK, we don't have as many. So I just felt like there was really a lack of representation from UK dermatologists, even more so from Black UK dermatologists. So I really just wanted to have a space where people can get good quality information in a format that's not too serious, educational, and really just help the community.
That's amazing. I love that. So what is your process to create health information videos?
So it depends. I personally love social media myself. I spend probably too much time on there. So if I see a video that either I want to stitch, or maybe a video of someone asking a question, or a video with information that's not correct or credible, that often encourages me to create some content. Otherwise, people will message me like, "Oh, can you make a video on this?" Friends and family will ask. I'll see videos that are interesting and I want to put my own spin on it. So I don't have a very set format. It's not very rigid. I just sort of see what's out there and then, decide what I want to put my own spin on.
Awesome. So do you ever find that some videos or maybe some questions on the comments section, do they ever kind of prompt you to go and do some research? Because I know that you love to create information in an evidence-based way. So you're not just giving your professional opinion, you're really fact-checking. So does creating content make you a better healthcare professional in that sense?
I think so. I think even the most basic of things, like let's say if I'm doing a video on eczema, and eczema is like every dermatologist bread and butter, I'm going to see at least like maybe 20 eczema patients a week. I'm still going to check the information before I do the video, just in case that you say something that's slightly incorrect and then it's online and you can't take it back. So I definitely think it spurs you on to research to make sure that you're very sure, very concise with the information. And I think it actually helps as well because the ability or the skill of explaining a concept within, 30, 40 seconds, keeping it succinct, getting in the key information, it definitely helps in your clinical practice as well when you're explaining things to patients. And definitely I get questions about things that I haven't heard of, 100%. The interesting thing about being online, there are certain things that circulate online. And then for those who are online, it's like, oh, like, that's obvious. Everyone's talking about it. But it's actually not the case. In real life, no one's talking about it. It's just a few random videos that have trended. Um, an example I could give is like the fact that, the Roaccutane nose job that was trending. All it is that Roaccutane shrinks the sebaceous glands in the nose. It makes the nose look a bit slimmer. But this isn't something that we ever speak about just in our normal clinical practice. But for whatever reason, it's blown on social media. And I do have colleagues where, someone has come in and said, "Oh, this Roaccutane nose job." And they've been like, "Sorry, what's that?" And I only know because I'm on social media myself. So I think it definitely helps you to research a bit more, helps you practice your information gathering and information sharing skills. And thirdly, it just keeps you up to date with what people are talking about.
Yeah, I love that. And just for the audience, in case you didn't know, Rectin is a prescription-only medicine that contains isotretinoin, and it's often used to help treat acne. And for something like that to trend on social media, it definitely needs to be addressed by dermatologists who know what they're talking about. Because I think, sometimes you can get really wrapped up with talking about something, but we don't actually know what the kind of legal parameters are around that, especially because there's kind of crossover with international audiences. So it might be okay to talk about it in a promotional way in the US, but not so much in the UK.
Yeah.
And so I guess that kind of brings up a good question, which is, have you ever been afraid to talk about something or challenged about what you're talking about? Because I know that some people, we were having a conversation in the health creator community recently where people could be challenged about, getting in trouble with the GMC or something. So what's your kind of mindset when it comes to that?
Mm. I think I've never had any huge issues. Of course, there are maybe some more older or traditional medics who don't really understand social media, so it can be frowned upon. I think the main thing is to always keep up to date because there are GMC guidelines, even though they're not very specific. And I know a lot of medical creators are keen to see, some more detailed guidance go out because we want to be guided. We want to operate in a way that is encouraged and supported by our regulatory body, but the guidelines just don't exist yet. So keep up to date with the guidelines that are there. And I think also I think the way that we conduct ourselves in person is the same way we conduct ourselves online. So if you wouldn't say anything controversial in clinic or, say derogatory things, then don't do that online. Just keep that same level of professionalism. I think you can be lighthearted. You can definitely show your personality. I certainly do that. But I think as long as you're keeping up the professional barrier, in the comments as well as in your actual videos. I think being online is helpful for everyone. It's helpful for the general community. It's helpful for other medics. I think there are lots of opportunities to be gained from being online. So yeah, I think as long as, you sort of use your, what would I call it, your professional intuition, I think, most of us are completely fine online.
I love that. That's really encouraging. Thank you. So, what impact have your health videos had so far? So, do you want to talk about maybe some comments or maybe some, in-person clinic kind of situations that you've experienced as a result of creating health information?
Yeah, sure. I definitely get, I know, a message every now and again that says, "Oh, thank you so much for making this video. I went to get my mole checked because of you." A lot of the time they say the mole was completely fine, but at least, they're still grateful that they were, encouraged to actually, take that step to look after their health and to be proactive. I get a lot of comments about, because I find that some of my most popular videos are explaining something that's super common, but people just don't know what it is. So, a lot of people will have this certain thing on their skin and they didn't know that it had a long, complicated Latin name. And just to have someone come online and explain, oh, this is this, there's nothing to worry about. It's super common. People are really appreciative of that. So I find that those videos are always really, really popular. And then also the other side is young people who are inspired to go into medicine or to create their own communities or to become dermatologists, or they have a greater understanding of what it's like to be a doctor through my videos. That is super, super rewarding. People saying that, I've been able to inspire them to, go for what they want to do. And I think things like that are super encouraging.
Yeah. So, what other things have you used your health information platform, your social media platform to kind of help with? Because I know that you've got some initiatives through House of Medics that you've been talking about, which is really awesome. So, I'd love if you could share some of what you're doing.
Sure. Yeah, so like I mentioned, the House of Medics is a community for all healthcare professionals that provides a space for people to network, meet one another, mentor the younger generation, and also get involved in outreach projects. I think for us, social media is so key. We wouldn't be able to do what we do at all without social media. It's just the best way of getting the word out with regards to what we do, what our ethos is, getting more people involved, marketing our events. It's just super, super key. to everything that we do. So we're really grateful for social media. Because how often is someone going to stumble across your website? They need to see your Instagram post, your TikTok post, and our YouTube. And I also love our YouTube channel so much because it's a platform for other healthcare professionals. There are lots of healthcare professionals that have great things to say, and are really great on camera, but they don't have any plans of starting their own YouTube channel. And, it's just not something that they want to do. And what we can do through the House of Medics is provide that platform for them to speak about what they do and to educate the general public and to get themselves out there, to reach out to young people who may want to follow in their footsteps. So, yeah, we've had such great results with regards to what we're trying to achieve through social media.
Amazing. And also, I just want to add that I learn a lot from your videos too.
Well,
So
okay.
I find them really interesting. And also because my husband is Black, it also helps me to have a better understanding of what he goes through when it comes to his skin. Yeah. So I think a lot of people who, may not have, you can't experience certain things. And so you don't have that level of empathy, but when you have a medical professional that's explaining it, it's really insightful for me. And then, that would be if I was practicing in the pharmacy, for example, and someone came to me with a condition, I would say, oh, okay, I've seen this before. I've learned this from Dr. Emma, but I still recommend that you go see your doctor to get it checked just in case. It's about having that familiarity as well because skincare is very visual. So people can be really conscious about certain things and they're not sure if they should be worried about it. And even recently, I got my dad to go and get some stuff checked. And now you can take photos of your skin and it goes to your GP and your GP asks you to come in and, he got a referral straight away, which is really just such a big improvement on the whole system rather than worrying about something. So
Mm.
that's really cool.
I love that so
Um,
much. Thank you for saying that.
and I also wanted to ask you, do people ever ask you, do people ever send you photos of things and ask you to take a look and stuff like that?
Yeah, yeah. So it is written in bold on my page, no medical advice, but people do it. And I understand it's really difficult to see a dermatologist. And I know that I have a reasonable size audience in America, and some of them can't afford the healthcare. So I do, and it's a shame. I just actually don't respond anymore. Previously, if I got the message, I would say, I'm really sorry, I can't give you medical advice online. Please see a healthcare professional. But then what was happening is they'd say, yeah, I know you can't give advice, but can you just have a quick look? And then they would send the first anyway. So now I just don't respond. I actually try just not to open any messages that look like, they're going to be soliciting medical advice. I understand how difficult it is. I know how long the waiting lists are, but it's completely unsafe for us to be, responding to pictures of strangers and various skin conditions online.
Yeah, I think it's really important that you've said that because some people do um, make a business out of it,
Yeah.
and it's probably not the best way to go about it. You do need to see things in person. You do need to, touch things, feel things, and also ask more questions, which is not appropriate on a platform that is probably has questionable privacy data settings, data privacy settings. Sorry. And so yeah, you don't want that health information going through those kind of channels. And they have the NHS app where you submit your photos to your GP. You know exactly where it's going, that it's going to be contained in that system and stay confidential. So yeah, thank you for sharing that. I think that's really good practice. And um, yeah, the next question is, what are your top tips for health creators who want to get started?
Oh, I would say if you feel like you want to start, just start. I think a lot of people are waiting for perfection, waiting for the right time. I think in life, there's never the right time for anything. You're always going to be busy. So if you have a passion for it, just go ahead. I think everyone that's been creating content for a certain time, after a while, you look back at your old content and you're like, oh my goodness, this was so rubbish. Like, why did I put this online? So it's completely normal. Just get started. Don't wait for the videos to be perfect. And, I might if I post a video today, I might look at it in 2 years' time and be like, wow, what a rubbish video. So I think that's just the nature of things. We improve, we get better. So don't wait until you think you're going to be perfect. I would say be yourself online. Don't try to create a personality online that's very different to who you are, because I think sometimes it's quite evident. Always double check your facts, even if you're confident. Just because someone might be basing something, super important or a health decision based off of what you said. So make sure it's 100% accurate. Just have that humility to double check everything before you create the post. Um, and yeah, don't spend too much time looking at the numbers. Just if you're creating quality content, your page will grow, and will eventually get the impact that you want to achieve. So yeah, I think we definitely need more qualified medics online just to help balance, all the other information online that isn't very good. So yeah, get online if you choose to do so.
Amazing. I love that. And so I wanted to also ask if you're comfortable to talk about this, that you often get gifted certain things. And so how do you approach brands sending you stuff?
Mm. Yeah, so I think you've got to be really careful about what it says when they're sending it to you. If they're sending it to you, they will usually include if they're expecting a video back or if they're expecting you to post it, etc., etc. And it's always going to be up to you, but I don't accept gifts where someone is expecting a post or is going to be, telling me to post. I'll only accept things that I know there's no obligation to post. I'll use the product and I'll speak about it if I like it. And there are opportunities, of course, to do paid brand partnerships, which is great. It's great to have an extra source of income. But again, I'll only post about products that I believe in. So just need to make sure that you're clear about what the terms and conditions are before you actually receive the product.
Yeah, that's really good advice because I think there's a big market for dermatologists
Mm.
because you have the credibility to talk about skincare, and so they want to associate themselves with you. So, how would you kind of advise people to think about brand deals in future if it's not dermatology? Maybe it's a medicine or something. I know
Mm.
that's a challenging question. But have you ever been approached by people who are not selling a cosmeceutical, or they're trying to promote maybe an over-counter thing, or what's your experience been?
I actually haven't. I've never been approached by anything that doesn't, fit into, the skincare realm or something that would cross that boundary, which is good. So yeah, I would say that if that ever happens, just be very clear. No, and I think the main thing is you have to know what you're allowed to do. So you have to do a bit of research, so that you can make the right decisions, because it's not something that gets taught to you in your general medical practice. And I think that's why we're so lucky as well to have our community. Like, it's so great just having a group of content creators that we can ask questions to and get feedback from. So yeah, I haven't ever been approached to promote something that would cross that boundary. But yeah, I think if that ever were the case for someone, then just have people that you can ask, that you can trust, do your research, and just be very clear with the company about what you are allowed to do, and also what you feel comfortable doing. Don't do anything that you don't feel comfortable with, no matter what the price tag is, because you don't want to do something that you can end up regretting later.
Yeah, that's very true. That's wise advice.
Yeah.
So, how do you fit in all of the stuff that you do? So, you're a dermatologist, and then you're creating videos, and then you might also be invited to events and things. How do you kind of juggle your time? And do you have a, set number of videos that you have to create per week? What's your kind of schedule?
So maybe ask me that question again in a few months. At the moment, I'm on a bit of a career break where I'm only working sort of a few shifts a week, while I'm waiting for my consultant job to start next year. So, if you're following me online and you think, oh, this girl's always at events, it's because I've got a bit more time than I usually would. But in general, I think, I've always been someone that's done a lot of different things and multitasked. So I think over the years, my time management skills have improved. And yeah, so with regards to creating content, I bulk record, and I think most creators do that. So, I'll only really record 1 day a week, and I'll try and record at least maybe 5 videos. And then I usually edit them on my commute. So while I'm on the train to work, I'll just edit them, and then I can post them throughout the week. I'm really not strict about the number of videos I create a week. And ideally, I'd love to post every day, but I don't, I just don't. And I think that that sort of attitude is what has helped me prevent burnout. Other people will have different goals from social media. Other people know that they want to grow this much. They want to, maybe make a certain amount of money on social media. So they'll be much stricter on themselves, which is totally fine. You just have to do what works for you. So yeah, that's what I do. I bulk record and I edit. I try to be careful with my editing time and maximize the time that I have. And I post, as much as I can. But if I can't post, I don't beat myself up about it.
So do you mostly film on your phone? And do you use the selfie camera or do you use the back camera? What's your kind of setup?
Yeah, I use the selfie camera, even though I know I shouldn't. Just find it so much easier to be able to see what I'm doing. Um, so sometimes I try and use the back camera and like do a bit more of a complicated setup, but sometimes I just really can't be bothered. And then sometimes I also have a little DJI Osmo Pocket, which I definitely use, if I'm like doing a vlog or if I'm outside. But again, sometimes if I'm just at home, I'll just set up my camera. Which is laziness, to be honest. I know I could get crystal videos by just changing my setup a bit more. But maybe I'll improve that a bit later. However, on our YouTube channel, we have a proper setup for that. For everything that goes on YouTube, we've got like a DSLR and some proper lights and things. So it's just my content that I'm just a bit lazy about.
I wouldn't call it lazy. I would say it's very efficient. And also, I think sometimes you have to give yourself the minimum setup that you need in order to do the thing.
Sure.
Because you make it too complicated, you're just way less likely to ever do it. And
Exactly.
I know
Yeah.
that if I ever have, sorry,
You have to pick your battles.
yeah, definitely. Because if I have to set up a green screen and I have to, have certain space and do all of this stuff, and it makes me more resistant to creating the content because I think about the hill you have to climb before you can even press record. So,
Yeah. Yeah.
I've seen that some of your videos you often we call it reaction content when you react to videos that other people have created. So what's your kind of process when it comes to deciding to react to a piece of content?
Hmm. So sometimes people have actually sent them to me. People have said, "Oh, can you react to this?" Sometimes that I'll see someone that's posted something and it's like, "Oh, like what is this?" And then I'll literally write in the comments, "Is it okay if I react to this?" And usually they say, "Yes, please." Really want to know what it is. And again, I'd only do that if it's something, pretty harmless. I wouldn't, give someone a medical diagnosis online. And then, yeah, sometimes I'll see things that are trending. Maybe other dermatologists have reacted to it. So I also want to just give my take as well. So, yeah, a few different avenues.
That's really interesting because I think it's important to have those boundaries as well. Because when you're reacting to something, you're explaining something, but you're not giving a medical diagnosis, so they can't,
Mm.
go and use that information to get treatment. But it might prompt them to go and get it checked out, and yeah, so I think that's really important. And also, I love your videos about lip balm, so I'm selfishly going to ask you for your lip balm recommendation.
Right. So, the classic lip balm. If you just don't want to really get into all this complicated stuff, just get the blue Vaseline. It's always going to do the trick. It's fragrance free. Petroleum jelly is entirely safe. It's been around for decades. So yeah, if you want something simple, get the blue Vaseline. Otherwise, some of my other favorite lip balms is generally I try to opt for non-fragrance lip balms because some of the fragrance can be irritating, can make your lips more cracked. And then if you have darkly pigmented skin, it can cause hyperpigmentation of the lips. So I tend some of my favorite ones are the La Roche-Posay Cicaplast lip balm, the Eucerin lip repair. Those are just like really basic fragrance-free ones that really do a good job of keeping your lips moisturized. I also love Aquaphor for the same reason as Vaseline, like just super simple. And then something that I really love, but even though it goes against what I've just said about avoiding things, so it has menthol in it, but I really love the Topicals Slick Salve lip balm. It's just super, super thick, so it keeps your lips hydrated for hours and hours because like who has time to be reapplying their lip balm every 2 minutes? So I think it's really great. And even though it has the menthol in it, I haven't experienced any irritation with it. So that's just my personal experience. But those are my favorites at the moment.
Also, thank you so much. great, like winter wellness tips there. Well,
Yeah.
I hope everything goes well with your new job next year, and you're enjoying having this kind of career break. And so, what will that look like for you next year? Are you going to be working, Monday to Friday in consultancy? Maybe do less, fewer events? What's that? What are you kind of building towards?
So yeah, I will be working full time, but I'll just be splitting my time across my NHS practice and private practice, which is quite exciting. Hopefully I'll still be able to attend, like lots of events. It's really great going to those things. You meet more like-minded people, you get to network. And also it's really important actually to learn about the product. So if a brand invites me to an event, it's actually a great opportunity for me to learn about the products and to see if the products are something that can benefit my patients, and also because patients will come and ask about certain products, and you want to be able to advise them and give them the correct information. So hopefully I'll still be able to keep up with as many events as possible and doing everything that I do at the House of Medics. But yeah, super exciting just to reach that next level of my training and to just have a varied week. Not being the on-call registrar anymore and having a bit more time to do the things that I feel more passionate about.
Amazing. Thank you so much. So I will wrap it up here. So thank you so much for your time today, and thank you to the audience for watching or listening. And we'll see you at the next episode.
Great. Thanks so much for inviting me.
A pleasure.